Hello, we're working on Molly and I. Brady, you can't see, who's kind enough to manage the camera here, but we're going to take you through a series of just some good basic foundational postural correction activities to try and undo some of the stresses of your work and occupational stresses. So we have Molly here, currently sitting on a pretty dense foam roller. We're going to have her lay back. We want to make sure that her head is fully supported onto the foam roller. So she's kind of from her tailbone up to the foam roller. We're going to then have Molly bring her arms up, and I really like to make sure people are above 90 degrees. So what I mean by that is a 90-degree angle here. So I don't want people down here because your shoulders will tend to roll in. So I want to make sure you're above 90, and then just let these arms relax down so you feel a very nice stretch through the whole chest, maybe even into the upper arms for a bit. Usually I'll recommend people do this for at least a minute, but up to 3 minutes if you could, once or twice a day. Just a nice, slow, gentle stretch. Make sure you're breathing regularly, not holding your breath. Then if we want to accentuate this a little bit, what I will have people do is gently nod their chin down. So it's like she's lengthening her spine a little bit from the neck area. And then I ask people to pull their belly button or their navel into their spine and lightly press the smaller arch of their back against the foam roller. That will tend to just intensify the stretch through the chest area. Don't be surprised if you haven't done this ever before that your arms might tingle and go kind of numb a little bit, but that should subside as you continue to get more flexible and pliable through that area. Then from here, we like this transition into a nice neck stretch. So I have people gently bring their head off the edge of the foam roller to the side, turn it just a little, take this hand and apply just a very gentle stretch. So here you can see we're going to stretch the SCM, the sternocleidomastoid, the clavicular portion. We can even get into the scalenes a little bit. We can move the arm maybe slightly extend it out. Again, just a much more unilateral or one-sided stretch, but very effective to help loosen up structures here that can cause numbness, tingling down the arm if you happen to be experiencing that. And then hold that for about 30 seconds to a minute. Come back to the center, and then we'll go off the right side. Bring the head off the edge a little, side bend, yep. And then she's going to take her left hand and just very gently intensify, again, the stretch through the sternocleidomastoid on this side. We have a sternal and a clavicular portion, and then the scalenes through here, and then keeping this arm, again, maybe just slightly above 90, will intensify the stretch through here. And again, you might experience some numbness, tingling. As you get more flexible, we should see that subside. Again, 30 seconds to a minute here. Once or twice on each side would be sufficient, once or twice a day. Okay, so next, I want to introduce you to our little Freedom rolling ball. So we use this quite a bit for body rolling. We're going to kind of specifically show you just more the spinal area, but know that we use this for a multitude of things. Piriformis syndrome in the butt, hamstring, iliotibial band issues. It's great for rolling out the back of the shoulders, for rotator cuff and tightness through the shoulders, especially if you're hovering around patients all day long or at a desk or a computer station. We get this ball specially made from Italy, so it's very unique. We're very excited to have it here. So what I have patients do is they're sitting on a firm surface, particularly the floor at home, position the ball so it'll kind of hit the middle of Molly's back as she lays backwards here. And then very important, she's going to interlock her fingers and her hands to fully support her head. And then before she does anything, she's going to slowly lean all the way back as much as you can tolerate. But it is important. The goal of this ball is for your spine to become pliable over the ball. Joseph Pilates used to say, you are as young as your spine is flexible. So our goal with this is to try to take your maybe somewhat rigid spine and get it more flexible again and reduce the postural stresses we're all dealing with all day long. So avoid holding your head up is a common mistake, tensing your arms or holding your breath. So Molly's going to meld nicely over the ball, which she's doing a great job, and she's going to roll all the way up into the upper thoracic, almost into her lower cervical, and then, yes, she's going to take a deep breath in. Beautiful. She's opening up her rib cage by expanding her elbows out, stretching. That's it. Breathing nicely, keeping her butt as low to the ground as she can. Yep, and we go just for now to about the lower thoracic spine, not into the lumbars, just because I don't know each of you in case there's anything to be concerned with, but through this area is generally very, very safe. And just very slow, controlled, methodical movements. It may be uncomfortable at first. Your spine might feel tender with the pressure of the ball, but that will all subside over the course of a few weeks. And you might even get some periodic subtle adjustments or pops and clicks from your spine, which again, generally are very safe and effective because this ball it has just the perfect consistency of soft and firm, but it is certainly not hard. I usually will have people do this anywhere from 10 to 15 slow controlled reps until they can literally work up to about 2-3 minutes. So let's say have it in your living room during a commercial. If you're watching a show, roll out for that 1 to 2 minute time frame. Once or twice a day would be wonderful. Remember, don't hold your breath. Keep your hips down low, your head down low, and allow your spine to relax so it will meld over the ball. Okay, so next we're going to have Molly perform what we call the chin nod. It's a very gentle exercise. We're just going to have her work on very gently while her head, back of her head, remains in full contact with the wall, or you could try to find a corner of a wall to stand against. Her shoulders are somewhat back, pressed up against the wall a little bit as well, very gently. Sometimes I'll have people even stand with their palms turned openly up, perfect. And then what I'm going to have her do is very gently just nod her chin down. It's only about 10 or 15 degrees. We are not trying to take the back of your neck, what we would call your lordosis, and press it up against the wall. We just want to do, which you'll be able to see from the side view, 10 or 15 degrees. I like people to hold that for about 5 seconds. We'll do 10 repetitions. As you do this, also I like to give people a visual of, so bring the chin down and in, like if there was a string at the top of your head, and it's also making you go tall. So we can help elongate your cervical spine, decompress it. More importantly, we're truly trying to target as much as we can the first and second cervical vertebrae called the atlas and axis, because we find if we can keep these posterior neck musculature limber and loose, it will help maintain the lordosis in your cervical spine, or if you have lost the curvature or lordosis, maybe, depending on the status and the health of your spine, we can try to reverse that process and work on getting your head back over your shoulders. The other things that's nice, a lot of times we will find either right-sided, left-sided headaches or just more tightness in the suboccipital area below the base of the occiput. So to augment one side, I'll have people turn their head to the left about 10 degrees, 15, right about here. And then as Molly does the chin nod again, you will feel it accentuate more that left side of your suboccipital spine. And again, all of this is meant to be very gentle. There shouldn't really be any pain, but you certainly might feel tight. In this case, I'll do 5 in this position. Then I'll have them come back to the center. Now go to the right about 10, 15 degrees. Do the same thing with the chin nod, 10 or 15 degrees, and that'll accentuate more the right suboccipital area to get at what we call the occipital atlanto or atlas joint, more so on that right side. And then have them come back to center. The whole idea, again, thinking of lengthening your spine, reducing the tightness, stretching these muscles that get tight and have a tendency to pull our head backwards but also forward, and working to try to slowly get our ears back over our shoulders. So 10 reps, 5 seconds each hold, roughly once, twice a day would be wonderful to help undo some of the stresses of all the computer work and everything that sort of pulls us down and forward. Okay, so now we've done our part to try to stretch some of the tissues in the front of the chest area, your arms, try to correct your postural alignment with the chin nod. Now we want to do our part to strengthen the back shoulder blades, scapular muscles, to give you the strength and endurance to maintain better postural alignment. So please know there's hundreds of different exercises you can do for your shoulder blades to try to strengthen them. I just particularly like these 3, and in a certain way. I like people sitting on a gym ball because it's slightly unstable, so they're forced to work their core a little bit. It can help promote really good alignment. Molly's done a great job. She's got a little curvature and lordosis in her lower back. her head is in good alignment as well. So the first exercise we're going to do is she's going to put her hand just like she does, kind of right near your left front pocket. This arm is going to extend to 90 degrees here, and then she's going to lift the band just at a diagonal, right? So if both arms were up, she would look like a V or a Y. And then she's going to come only back to 90 and repeat that. And the big thing too I want people to appreciate is, if you can tell, if a wall were here, Molly's pushing into that wall just a few more degrees. I call it just get that little extra plus to really work to squeeze the shoulder blades. I'm a big fan of doing one arm at a time so that you can't see it back here, but we're also getting a little spinal mobility at the same time, right? When we tend to do bilateral work at the same time, we're not really, we're kind of keeping the spine in neutral versus really forcing it to rotate and move. I usually like people to do somewhere between 8 to 12 reps of this. So, once you can do more than 12 consistently, then we would go up in a band. Right now we have Molly using yellow, which is our lightest band, but there would be a way to graduate. I really like to get people up to blue or black at some point. And then we would switch. She'll put her right hand near her right pocket. Her arm is at 90 degrees. Notice too, I like the thumb up. So on both sides, the thumb was up. Same thing. She's going to kind of reach back at a slight diagonal. So she's sort of positioning her arm in part of a V or a Y with that just added little plus backwards. Good postural alignment here, holding her belly button in, so she's engaging her core at the same time. And what you also can't appreciate, right, while this is the working side, this side is having to stabilize. So Molly's actually also engaging her scapular musculature back through here. Let's do one more. Perfect. And then we'll have Molly grab with her palms up, thumbs out. She'll put her arms at 90 degrees, elbows fairly straight. Yep, perfectly. That arm's going to remain stable on the left, and she's going to swing this arm all the way back again with that little added plus and come back to the center right through there. Yep, perfect. Just a little plus to about here. Beautiful. And again, some of you may be pretty tight in the front as well as weak. You may not be able to extend back as far as Molly is at the moment, but you will get there. Perfect. And making note too, she's doing a good job of not elevating her traps too much. Sure, they're going to fire a little bit, but we don't want you hiking your shoulders up into your neck. Again, 8 to 12 reps on one side, and then we'll have her switch and do a few on the left. That's beautiful. Yep, perfect job. Coming back to the front and reaching back. Excellent. Good job. Let's just do 2 more. Again, 8 to 12 reps. I usually like 2 sets, and I really encourage people to do these series of strengthening exercises just 3 times a week. You don't need to be doing these daily. And then I'll have her relax, and then we will go on to the third and final exercise. But again, no, there are numerous ways to strengthen your shoulder blade muscles. Now we're going to have her extend her arms all the way up overhead, so she's going to reach super tall. Again, she's at about shoulder width, even a little bit more extended backwards to start. Yep, right in here. Right, she's in good neck alignment. She's got her core engaged. Left arm will be stable, and now she's going to bring this arm down to her side, only to 90 degrees, back up. The whole time, I would like to correct her a little bit that she reaches, that band is coming behind your head. That's it. What you will find is you fatigue, the band will start to come more forward as you get tired. But I find if you really work hard to reach tall, keep that band behind your shoulders, it's really maximizing some good scapular retraction, scapular control, and helping promote good posture. And here, just down to that 90-degree point. And let's do a few on the left. Quality is more important than quantity. If you can only do 5 or 6 good ones, then that's all you do. Do 5 or 6 good ones until you can work up to that maximum of 12. And then once 12 reps, again, gets very easy, I really encourage people to upgrade to the red, green, blue, and then the black band. And again, keeping this arm right here. Yep. And relax. Good. Perfect. Excellent. So great way to help strengthen the shoulder blade musculature. Again, 2 sets if you can, 8 to 12 reps, 3 times a week. Okay, so the next thing we want to show you is just a really nice way. Maybe let's say in the office when you don't have time to get down on the floor and do the foam roller. It's a great way to stretch your entire sort of finger flexors, your forearm area, right? Any carpal tunnel related symptoms, a little bit of ulnar nerve symptoms, any neural tension stuff that you might be experiencing from the type of work that you're doing all day long. So in this case, Molly's going to put her hand up against the wall. I really like to have the thumb and fingers spread out a little bit to go wide. I want you, as if you can, position so your forearm is about 90 degrees. So we're getting a really good amount of wrist extension through here. And then Molly's going to gently rotate away to the right, which for most of you, you should feel a fair amount of pulling through the chest into maybe the anterior bicep, but then more importantly, into the forearm. You know, if you don't, like in Molly's case, she could step back a tad, which will put her wrist into even more extension and feel that stretch. So what I'm ultimately trying to target for most of you, though, is to get through these forearm flexor muscles that will tend to get very tight and restricted from holding utensils and things all day long. Again, 30 seconds to a minute. I encourage people to be more gentle. No pain, no gain doesn't apply. We want this to be a very gentle, gradual stretch. Let's say if 10 was an intense stretch, only about a 2 or 3, because if we do get a little nervy involvement or a little nerve stretch, nerves tissue can be highly irritable. We don't want to irritate the nerves, but we do want to improve their mobility within the fascial system and the musculature. And then we'll have Molly switch sides. So now she'll put her right arm up. Yep, same thing. Remember, try to keep this at roughly 90 degrees if you can. Yep, elbow straight, shoulder height roughly. Yep, and she's very gently, in this case, turned away or to the left. Again, to try and get a really good stretch through the front of the chest here, bicep area a little bit, and into that front of the forearm. 30 seconds to a minute, once or twice each side, once or twice a day. Wonderful.